everybody. Thank you so much for joining us. I am Dr. Sheila. That is Sheila Craig Whiteman. And I am your host for today's show, Living Well with Dr. Sheila. As you know, each week we have a different guest, and each guest gives us a little bit more information on how you and I can both live our most healthy life. I have a doctorate in physical therapy. I am a physical therapist, a health coach, and I also specialize in women's health and lymphedema. So those are my two loves in life, but I also love educating the public on how they can live well. For me, every week, I try to find somebody just different that we can learn something from. And this week, I am lucky to have Kathie Hardy. And she is an RN. I'll read her initials, but she is going to talk to us about what her initials mean. For some of them we know, but some of them we might not. So she's an RN, MS, MBA, BCH. So I'm going to be looking back and forth now because now I'm going to read her bio. She is a board certified hypnotherapist. She's a speaker, and she is a 2-time #1 best-selling author on Amazon. Her 2 books are Migraine Relief with Hypnosis, Quit Smoking for Good with Hypnosis Without Gaining Weight. Also, she's known as the Bad Habit Hacker. That's great. Kathie plays Celtic harp professionally. See, that's why we got to talk about what she does, because, I mean, really. And is an avid downhill skier and master gardener. I've seen pictures of her garden. Beautiful, absolutely beautiful. You can see the video on how she became a hypnotist on her website, www, and I'll put this up later, and she's going to correct me on how I say this because she always does, Salish Sea Hypnosis.com. So we're going to go ahead and welcome Kathie to the studio. Hi, Kathie.
Hello, Dr. Sheila. Thanks for having me on your show today.
You are quite welcome. So we are going to start right out. There is so much information that we have that we're going to talk about. So let's start out first. Tell me about your background. So I talked a little bit about in your intro about how you an RN, but you also, especially the last initials, can you tell me a little bit about that?
Certainly. So the RN, of course, stands for Registered Nurse, and MS is a Master's of Science in Nursing. And then I won a Commonwealth Fellowship years ago and was awarded enough money to get either a doctorate in nursing science or a master's in business administration, because at that time there was a organization that was trying to help prepare nurse managers with business skills so that they could more effectively advocate for patients and nurses at the hospital level. So I received my master's in business administration, and at that time I was in administration. I had manager and director jobs. And then I was working in an intensive care unit job, and a man I was dating took me to a party, and I met a hypnotist. And that hypnotist told me that people could be helped to stop smoking in as little as 1 to 2 sessions. Now, a lot of people know that. You probably know that. But at the time, I didn't know that. And my mother and my grandmother had both died from smoking-related illnesses. And I remember feeling kind of angry that none of their doctors ever said, you could see a hypnotist and quit smoking and maybe not die of lung cancer. So I thought about that. I did some Google research, and a day or 2 later, I was standing in room 2 at that time I was working in an intensive care unit. I went back to bedside nursing after about 10 years of administration because I found that I really didn't like being responsible for other people's behaviors. I like being responsible for my own behavior, and I really loved bedside nursing. I love the technical aspect and the intensity of the emergency department and the intensive care unit, and I was really good at it. So there I am standing in the doorway of this room, and I'd been assisting a woman who's detoxing from alcohol. And a lot of people don't know this, but you don't usually die from detoxing from meth or heroin, but you can die from detoxing from alcohol. And so when you arrive in the emergency room unconscious with the blood alcohol off the charts, you're buying yourself a couple of days in the intensive care unit with one nurse every 15 minutes around the clock. So I've been working with her all day, and I just remember that day so clearly because it was a busy day. The other nurses were so busy that I didn't feel anyone could really watch her closely enough. So I hadn't had a lunch break. It was 3:00. It was a Tuesday. And I stood in the doorway and I watched her get out of bed unsteadily. She put her clothes on and she walked out the door and down the hall against medical advice. There's nothing I could do to stop her. She has the right to leave. I wasn't sure she was going to get out the door without falling, but I can't force her to stay and get treatment. And she was going to cross the street from the hospital to the convenience store to buy a beer and start the cycle all over again. And I knew her well. I'd taken care of her many times. All the nurses knew her. And I thought to myself, it's too late for her. But there's probably a lot of other people who could really have used some help years ago to get help for their alcoholism or their smoking or their chronic pain management or so many other things. So I thought, I'm in a place in my life where I can spend any amount of money I need to educate myself. I can go anywhere in the world and I can study with the best hypnotists and I can learn. I'm good at learning. I have a lot of initials and I've collected lots of degrees and certifications along the way. So I knew that I could learn to be a good hypnotist. So I just started. I enrolled in school. I enrolled in certification programs, training programs. I went to the national conferences. And actually, since then, I've become a speaker at national conferences. We'll talk a little bit more about that, I think, a little later. But anyway,